Tretinoin, it really is a dermatologist pretty poorly kept secret. This is the best drug that we have for better aging of the skin and for acne. I'm Dr. Emma Craythorne, a consultant dermatologist, and in this video I'm going to be taking a deep dive into tretinoin and the kind of things I'll tell my patients whenever they're considering starting this medication. There is only one drug that we think of as being gold standard for anti-aging, although I hate that term, better aging of the skin and acne, and that is retinoic acid, aka tretinoin. Now, tretinoin itself is a retinoid, and you can find retinoids kind of all over the skincare shelves, and you usually see these in the forms of something called retinal or retinaldehyde or retinol or bakuchiol or retinyl esters. All of these are part of the same family of retinoids, but they are distinctly different from tretinoin. Tretinoin is the drug, and everything else I've described to you is derivatives of that. Now, what that means is that all of these other ones have to go through transformations or changes within your skin until they become the retinoic acid or the tretinoin essentially, because that is the active part that integrates within the nucleus of the cells and activates genes that you want to have switched on. And that's genes that's particularly in the keratinocytes, which are the skin cells responsible for making the outer part of our skin, and also fibroblasts. And these fibroblasts are cells that are responsible for making things like hyaluronic acid and collagen, the things that keep our dermis really nice and bouncy. In dermatology use, this has an FDA license and is part of the National Clinical Guidelines for use for acne, and that is across the board, all forms of acne. And the reason for that is topical use of this is the thing to stop those blackheads and whiteheads from forming. The other indication that it has, again with an FDA license, is for the treatment of photodamage or photoaging. In other words, skin that has been aged excessively by UV exposure. And that is in the form of things like dyspigmentation, so brown marks and splodges on the skin, as well as an exaggeration of fine lines and wrinkling that can occur. It is also first-line treatment for consideration of conditions like melasma, as well as post-inflammatory hyperpigmentation. It is a bit of a misunderstood drug because quite often people will think of it as being something that is inflammatory, and that is not the case. In fact, this is thought really of more being an anti-inflammatory kind of a treatment rather than inflammatory. However, at the very beginning, whenever you first start using it, there can be a bit of disruption and inflammation can occur. Some people have also said that this drug will make you more sensitive and you will be more likely to burn in the sunshine. Again, that's actually not strictly true either. It doesn't change your minimal erythema dose, so you're not more likely to burn. You need to wear your SPF because the stratum corneum, or the outer part of it, becomes a bit more compact and essentially is exfoliated a little bit better. But you're not sensitized to the sunshine from this drug. The other thing that sometimes people say is that it thins the skin. And again, that is not true. It does compact the very top part of the skin called the stratum corneum, and that's actually why it's responsible for getting a whole lot of light bouncing back off the skin. But the epidermis, which is the bit underneath, and the dermis underneath that again, these actually thicken up with time, which is why it's so great in terms of things like very fine, tiny, little wrinkling of the skin, or actually even having an effect on thicker wrinkling of the skin as well. When it comes to treating acne, the main reason that it is an effective treatment is because it helps to kind of regulate that skin cell turnover. Whenever somebody has acne, often the skin cells are turning over a little bit more sluggishly and slowly, and that's particularly whenever it's down the sebaceous gland or the hair follicle. And as that's kind of very slowly turning over, it gets a bit sticky because the kind of contents of the sebaceous gland, the sebum, come out, mix with it, and it ends up getting more sticky and blocks that follicle. When that follicle is blocked, that is something called comedone, and comedones are the precursors of acne essentially. So why this treatment is so good is it is that particular thing that tries to stop the acne essentially in its tracks. It stops the formation of the comedone. Whenever we think about evidence for tretinoin in photodamaged skin, or something like wrinkles is a way of thinking about this, there are powerful studies that have been around really from the 80s, and these have huge numbers of patients within the studies. They are randomized controlled studies, as well as actually looking at biopsies of human beings' skin after they have actively been on these treatments. So we know that this works. We know that this will have a biological shift and change within the skin, and that is different to any other ingredient that we have. That said, tretinoin is not suitable for everyone because this is a drug. That is the most important thing to say. It is a drug. It requires a prescription. Within the UK, you cannot get this drug without a prescription. In order to have the drug, it has to have an indication, and it has to be an appropriate indication in order to have the drug. And then you have to be supported on the use of your medication, because at the beginning, it's certainly not an easy ride with tretinoin. You do need to have support to make sure that you're on the right solution, that you're getting to the right dosage, that you're able to tolerate any potential side effects that might go alongside starting that medication. It's then understanding what those side effects are and how to manage them, because the key is, once you get to the other side, that is where all of the good stuff is whenever it comes to this treatment. And so in a nutshell, it is our secret weapon in dermatology, but it is also not so secret now because most people do know that. It is our number one better ager of the skin topically, hands down. If we're thinking of a timeline of how effective application of tretinoin could be, it would go something like this. From 0 to 2 weeks, nothing too much happening. You might start to notice a little bit of irritation and dryness in these areas here if you've kind of let it slip into that area. Weeks 2 to 4, you might start to be noticing a bit more of irritation here and here, and actually starting to just suddenly see my skin feels and might look a little bit more smooth and glowy. By week 6, the purging will start. So if you're somebody who's going to start making spots as a consequence of applying the tretinoin, particularly for people with acne, then the purging starts around now and actually carries on to about week 10, 12. By the time you get to week 12, the purging will have started to settle, and you will start to see that increased skin cell turnover and the compactness of the stratum corneum really is resulting in a much better glow to the skin. Once you get to around about 4 or 5 months, you're starting to see shifts and changes in the pigmentation. So where there might be hyperpigmentation as a consequence to previous trauma or because of UV-induced radiation, then you start to see a fading in that abnormal pigmentation. And then by month 9, that is whenever you're starting to catch the first glimpses of things like periorbital lines and wrinkles becoming much less than what they were. So the studies show that is the real sweet spot. Continuing on with your tretinoin, and you continue to see this dermal remodeling, and those changes just continue to improve over time. So starting a tretinoin for some people can be a little bit complicated, but these are my go-to tips that tend to help my patients stay on with their treatment. First of all, you have to understand that you have the right diagnosis. Tretinoin is not something to be used unless you have that clinical diagnosis made for you and then the treatment started appropriately. This is not something that should just be used willy-nilly. This is a medical treatment and it needs to be used appropriately. That's definitely number one. So what is the diagnosis that's being treated? Number 2, ensuring that the dose of the tretinoin that's being prescribed is correct for that indication. And so really for somebody who is doing this for photo damage, you want to have the dose at around about 0.05% or higher. And for somebody who's using this in the form of acne, it would be for between 0.025 and 0.05%. The third most important thing is looking at the surrounding routine. This is incredibly important because tretinoin, whenever you first start using it, and actually even from time to time when there's changes in weather or changes in the environment, it can be irritating. That supporting routine, I think of it, has to be as good as possible. And by good, I mean gentle. So I'm thinking typically whenever it comes to cleansing the skin, I would want to have somebody using a cleanser that's often an oil cleanser or a cream cleanser. It doesn't necessarily need to be fragrance, and it certainly doesn't necessarily need to have other active ingredients in it, because whenever you're using a tretinoin, there is nothing more powerful or effective. So you don't need to have something oftentimes in your cleanser, because it's just an also ran compared to the treatment that you've been put on. So a gentle cleanser is key. A moisturizer is key as well. And using a moisturizer that again doesn't have additional active ingredients in it is really important. Moisturizers need to moisturize the skin. They have to have a nice balance of ceramides, free fatty acids, and cholesterol. And this combination of the ceramides, free fatty acids, and cholesterol means that the skin barrier is being supported as best it can. And then obviously your SPF. It doesn't matter what the SPF is, it doesn't matter who makes the SPF, but you just have to want to use this SPF. And it must be an SPF that's around about a 50. 30 is okay if you're applying it properly, or a 50. And ideally I wanted to have a UVA rating that is 4 in terms of the plus sign, or a PPD above 16, or a 5-star Boots rating. So a really good coverage of UVA. And you must apply that. That is it. That is the basic skincare routine that's required to support using the drug tretinoin. Now, at the very beginning, whenever you first start using it, it should be applied at night time to a clean, dry face. I would suggest cleansing the skin and patting it dry. At the very beginning, you might want to wait about half an hour before you put on the tretinoin. When the skin is a bit moist, it just means more is going into the skin. As time goes by, you'll be able to put it on straight away. But at the beginning, for some people, maybe just waiting to make sure the skin is really dry can be a key to stop some irritation. When you're applying it to the face, you don't need to put it by the corners of the eyes, or the corners of the nose, or these folds, or underneath here. Don't put it in this area, because when you sleep at night time, essentially your face, moves on the pillow, and everything moves towards these areas anyway. And what can happen in these areas is they rub together slightly, and you get this intertriginous change. So you get more of a dermatitis in these particular areas. Over time, you can be a bit more relaxed in this, and it can get into those areas when you're putting it on at night time. But at the beginning, you really don't want to put it on in these areas. Even if that is a little bit too much for some people, you can do what's called a sandwich technique, where you apply your moisturizing cream to your face, you then apply your tretinoin, and then you apply your moisturizing cream over the top. And even if that is a bit difficult for some people, you can do what's called the short contact approach, where you would get the tretinoin and you would apply it to the skin, and after 30 minutes, wash it off, and then put your moisturizer on and go to bed. And the next night, you could do the same. And then the next night, leave it on for 60 minutes, and then wash it off. And the next night, do the same. And then the next night, leave it on for 2 hours, and then wash it off. And the next night, do the same. And then the following night is you could perhaps try leaving it on overnight and see how that goes. So this is a kind of build-up approach that you can do to get the skin used to using a tretinoin. And I have had patients with even the most sensitive skin that you can imagine, particularly actually on the television show, that we're able to get onto the drug because we know it's going to make such a difference to their skin. Before seeking out any individual ingredient to treat your skin, you need to ensure that you understand your skin correctly and you have the right diagnosis. A great place to start to get a bit more information about your skin is to go to www.klira.skin.